Good morning. My name is Dr. Jana Rudstein Shalina. I usually go by Dr. Shalina, and I am associate professor at the Department of Obstetrics and Gynecology at Icahn Medical School at Mount Sinai. And I'm also part of the faculty practice. So I have a small private practice with my partner and midwife, and we practice obstetrics and gynecology, mostly obstetrics. Well, it depends because this may happen at different stages in our life. So, for example, the younger we are, the easier is to get pregnant for us. In our 20th, it may take 1 to 3 months to get pregnant. And as we're getting a little more mature in our 30s, for example, we should expect a 6 months interval to get pregnant. Well, it involves a lot of different aspects because let's face it, we're all women right now, we all work. And I would include our professional life actually into planning for the pregnancy. Let's say we do practice in different fields. And let's say you're an accountant. So you definitely don't want to plan your delivery date close to March or April. Or you also don't want to be in the very early stages of pregnancy when you may not feel great also at the same time frame. Or vice versa. Let's say you're a teacher and you definitely want to deliver somewhere in April and May, because then your summer vacation will smoothly continue into longer time with the baby. So you can spend more time with your family and with your newborn baby without cutting into your vacation time. And it's a pretty good time to, spend time with the family. It's summer. So that's definitely something I would take into the consideration. For example, the stresses at work. I wouldn't plan to be in the very early pregnancy or delivering, when it's the most stressful time. And also, I would also plan to save a little bit more money because financial security also may play a role in some pregnancies. Let's say the pregnancy is a little more complicated than you expected, and you need to take a little more time off. And having extra money saved gives you a lot of flexibility and takes away a lot of stress. Also, family help. Let's say your mom or your aunt or your friends could be more available to help in the winter or in summertime. So also you may want to spend some time with your family elsewhere. So traveling plans also could be including in planning. So there's so many aspects. I usually recommend stopping using birth control around 3 to 4 months before ideal conception time. Why? Because most of the young women have been using birth control since late teens, let's say early 20s, and you don't even know how your menstrual cycle is going to be. It takes time to get it back. So to get a great picture of how regular the cycle is and what the cycle is it 25 days or maybe 32 days, to figure out, if there are any problems with the cycle to begin with, or when I'm going to ovulate, what my cycle length is. So also, I recommend as soon as you stop taking the birth control pill, I recommend starting the prenatal vitamins, fish oil supplement, and or vitamin D if needed. It also takes time to fill up your body with all goods, and be at the perfect shape. There are quite a few which should be optimized, most of them stemming from problems in a gynecological health. Let's say, for example, irregular cycles. It could be a part of so-called PCOS or polycystic ovarian syndrome, which has to do with irregular or absent ovulation. Endometriosis, it's well-known cause for the problem with the fertility. Thyroid condition, also one of the very common issues young women may deal with. And again, it takes time to optimize them and, just optimize the fertility. Diabetes, a big issue. Weight issues, for example, extra weight may affect the menstrual cycle and ovulation. So optimization of the weight, not only extra weight, but also underweight could be an issue. And of course, cancers. Unfortunately, cancers do happen in young women. Mostly it's the cancers of the blood, such as lymphomas, leukemias, consequences of chemotherapy in the past. So also could be an issue. Not that many, because most of the medication would work to optimize the body and help you to achieve fertility. But yes, there are a lot of medication use which could affect actually not so much fertility, but sometimes the baby formation. For example, very common medication in dermatology, Retin-A, Accutane, retinoids may affect development of the baby. Again, going back to cancer therapy, those medications could be harmful. Some herbal supplements which are untested may be a concern affecting the fertility, because we don't have much studies on herbal remedies, to be honest. That would be great, because even though our diet most of the time is abundant and we have a fantastic resources, but sometimes we do need to start taking our prenatal vitamins. I definitely would highly recommend prenatal vitamins, because they do give us an extra folic acid, which is the major help in prevention of spina bifida formation. Vitamin D deficiency is a huge emerging topic as well, because a lot of women right now are vitamin D deficient. And it comes from us using a fantastic skincare, literally blocking the sun, penetrating our skin. That's where the natural formation of the vitamin D happens. So we do need vitamin D. Fish oil, very important. It's a little building blocks in nerve cell membrane. We need smart kids, so we do need our omega-3, omega-6. And we can take a supplement such as fish oil in lay language, or we can use the same supplements as DHA EPA, which is medical term for the fish oil. There are also fish oil or pretty much sources of DHA coming from plants, such as algae. It's for example, for vegetarian part of the population or vegan population. So there is the plant-derived sources of omega-3 and omega-6 as well. I wouldn't go drastically changing the diet, and I would just stay healthy. I would avoid extra use of maybe carbs, or use carbs coming from healthy sources such as multigrain, whole wheat. I would probably avoid use of hard liquors, definitely quit smoking, but otherwise I would try to use healthy, balanced diet with a good amount of protein, healthy fats, and healthy carbs. I usually do recommend a preconception counseling, which may or may not involve the genetic testing. We do routinely now in the first prenatal appointment offer a very extensive genetic panel, including 283 conditions you may be potentially a carrier, but the preconception counseling would actually address many more issues. And that's something we discussed before. For example, evaluating your overall health, need for adjustment in a diet, need for weight changes, or checking your thyroid. Also important to check the immunity to make sure you're vaccinated and your immunity is up to date. And you would start the pregnancy protecting yourself and the baby against this exposure to many viruses we have around. pregnancy genetic counseling is also available, and you may review your family history as well as your husband's family history with the genetic counseling, and all the testing also could be done pre-pregnancy, avoiding any unwanted surprises in the first trimester. I would say by learning more about yourself and about your body, as just stopping the pill, for example, a few months before, to learn about the menstrual period, about your cycle, about your health overall, and maybe talking to your doctor and making sure you're in a great health and there's no potential reasons to any potential reason to be on a way for you to become pregnant.